Okay, friends, strap in. This is going to take a little bit of time. Figure about 3.5 minutes. So, this is the health belief model. So, as a natural health professional, it's important to understand the obstacles to compliance you may face with your patients and know how to intervene to ensure your patients take the health actions that you recommend. The health belief model, or the HBM, is a theoretical model that's used to understand how people make decisions about their health. The model suggests individuals will take action to protect their health if they perceive themselves to be at a particular risk for this problem, and if they believe that the benefits of taking action outweigh the cost associated with doing so. Now, the HBM consists of several major components. The first set of components are individual perceptions. Now, this includes perceived susceptibility and refers to someone's belief about the likelihood of contracting a particular health problem. Am I going to get it? How likely is it will I get this thing? And then the perceived severity, as this refers to someone's belief about the potential consequences of that particular health problem. In other words, how likely am I going to get the flu? And severity refers to how bad might it be. Now, this leads us to modifying factors, including the demographics, the patient's gender, age, ethnicity, personality, socioeconomics, and overall knowledge. That's a pretty big field there. Now, the perceived threat combines those overall threats, which is influenced by someone's assessment of the likelihood of contracting and the severity of the problem. If you follow the arrows, this will make sense. Cues to action. Now, this refers to the external factors that prompt an individual to take action, such as a reminder from you, the healthcare professional, through an email or a phone call, or an advertisement about a health product. And finally, a very important modifying factor is self-efficacy. Now, self-efficacy is the person's belief in their capability to execute a behavior to produce a specific outcome. Or in other words, the belief that they can do what they set out to do. Make sense? The belief that they can do what they set out to do. That's super important. Now we turn our attention to this other factor of the model, which is the likelihood of action, which includes two final factors of this model, which is perceived benefits, which is the individual's belief about the effectiveness of a particular health action in preventing or reducing the health problem, which is also influenced by modifying factors, and the perceived barriers. Now, this is an individual's belief about the costs, the barriers, and it's associated with taking a particular health action, which in turn is influenced by the perceived threats. Now, here's an example of the health-based model in action. Imagine a person is considering getting a flu shot. The individual might weigh the perceived susceptibility to the flu. How likely am I going to get it? The perceived severity of flu. How bad will it be? The perceived benefits of getting a flu shot, and the perceived barriers to getting the flu shot, such as the cost, the inconvenience, the fear of needles, and their belief of whether they can follow through before deciding or not to get the shot. So this theoretical model is a useful tool for practitioners to better understand how people's beliefs influence their health-related actions and behaviors. Ultimately, this knowledge may be useful when treating compliance-resistant patients and modifying your approach to increase compliance. It's frustrating when you give medical advice to your patients and they come back 3 weeks later and haven't done what you've asked them to do. This model is a way to help kind of modify that and bring them into compliance. Now, try out the model. Let us know how it works for you. In the meantime, think about this. A practice coach may seem like a luxury you can't afford, but what if you could shave years off your learning curve and increase your bottom line more quickly? Give us a shout if you have a question. We love to chat about practice. We love to chat about marketing. Love to chat about theoretical frameworks. Remember, your marketing plan is your compass. If you don't have a marketing plan, we got you covered. Our website has a free marketing plan guide you can download. You can go to prosperpracticecoaching.com and get that. Tell your practice friends about Prosper Practice Coaching, and have a great day. Cheers.